Hello, everyone. My name is Ryan Gormley, and I'm here to talk to you today about HPV and its vaccine. HPV continues to be a dangerous and deadly disease in our world today, so it's really important that we have an understanding about it and its effects. I just wanted to provide a quick disclaimer before I start going into the presentation. So just keep in mind this presentation is not meant to substitute as medical advice or consultation. You've got to visit your primary care provider or another provider for more information and ask any specific questions. So this is not meant to be legitimate medical advice, but more of a presentation on the information associated with HPV, and you can formulate your own opinions about it as you please. All right, I want to see what information you already have about HPV and the vaccine for it. So please click on that link provided and answer the questions. Feel free to pause the video and take a few minutes to fill this out, and then you can go ahead and continue the video. All right, thank you for taking a few minutes to fill out those questions. Again, my name is Ryan Gormley. I am a PA student from South University here in West Palm Beach, Florida. I'm originally actually from the frigid state of Minnesota. It gets much colder there in the winters than it does here in Florida. So I came down here in December 2020 to start school at South. We are actually the first class of PAs to graduate from this campus of South University. And we'll actually be graduating in this upcoming March of 2023. And then we'll officially be able to get certified and get licensed to practice medicine when we pass our boards. We are all excited for it. We are currently going through clinical rotations at the moment. So on that first slide, you saw that I had the initials PAS. So this is my official title for the stage I'm at in my profession currently. It stands for Physician Assistant Student. The career itself, once you get through school and are practicing, it gets changed to PAC. This stands for Physician Assistant Certified. So that is essentially what PA means when I reference that. The official name is actually Physician Associate. That was changed, I believe, last year in 2021 by the National Association that works with PAs specifically. The well-known name, the one that everybody knows us usually as, is Physician Assistant. So until we can get that legally changed to Physician Associate, in practice, we'll still be using Physician Assistant. But the role of a PA, we are medical providers that see patients, we prescribe medication, and we develop treatment plans similarly to other providers, just like physicians or doctors, is what you would usually call them. We are legally supervised by physicians, and autonomy is earned, but it's usually given with experience. What I mean by that is we're not just given free rein to go out and practice medicine the first day that we graduate. We are legally supervised by physicians, but we also need some training initially. Because, doctors, when they get out of medical school, they do a residency as junior doctors before they're able to go out and practice independently. PAs are dependent practitioners, as in we are legally supervised by physicians, but usually the autonomy, the amount to practice medicine independently will grow as we develop more experience. So once PAs get a couple years in the field of medicine that they're practicing, they usually will have a fair amount of autonomy. So this is just a very small introduction into what a PA is and what we do, but I wanted to at least give you an idea, since I think it is important. There are a couple different types of providers out there in the world that provide medical treatment and consultation. All right, so the basis for this project is Healthy People 2030. So I wanted to give some information about that, as well as some statistics to consider about HPV, the HPV vaccine, before we go into it more hardcore. So Healthy People 2030 is an initiative by the government to better the population's health and well-being over the next decade, so 2020 to 2030. The HPV vaccine rate, according to Healthy People 2030, is 54.5%, and the goal is 80% overall. So we have a lot of progress to make. That's a huge goal that's not being met at this moment. So just some interesting statistics, I thought. For the year of 2020, the HPV vaccination rate of adolescents, so this is ages 13 to 17 nationwide in the US, for at least one dose of the HPV vaccine, it's 3 doses in total, so 3 vaccines, was 75.1%. For the same year, 2020, the HPV vaccination rates of adolescents in the US, ages 13 to 17, for the 3-dose series, this is all 3 of them, so the complete series, was 58.6%, much lower. So the full completion of HPV vaccine series is not significantly high. It's lower than the other vaccines, and it really could use improvement. So an introduction to HPV, first of all, it's referred to as human papillomavirus. That's what HPV stands for. And what exactly is it? HPV is a viral infection. And if you were to learn a little bit more about medicine, learning how to treat bacterial, viral infections, you'd understand that viral infections are really hard to treat. It's not as simple as bacterial infections where we can just give antibiotics and hopefully that would work and cure the disease. Unfortunately, certain viral infections like HPV are not curable at the moment. So it is really unfortunate, and this is why we want to make sure that we can get information to people and make sure that they stay protected so they don't get a disease like this. That is literally a lifelong disease. It is a sexually and contact-to-contact transmitted disease. So a sexually transmitted disease can be obtained when you have vaginal, anal, or oral sex, but you can also get it from skin-to-skin contact. This could be something like kissing another person through saliva. And this is exactly why, since it's so easily transmitted, is the most commonly sexually transmitted disease in the US, above all of them, which is pretty significant. So just a side note, for the rest of this presentation, just so you have that general thought in the back of your head, the more sexual relations that you have, the more exposure you have to HPV. That is important as I go through some of the information. So this is a concern for healthcare professionals due to the increased cancer risk. We'll go more into that and stuff too, but this is a serious disease because it can lead to cancer. And some of these cancers can include, it's different between men and women based on anatomy, and some are the same between both. But in women, women develop cervical, vulvar, vaginal, anal, and throat cancer. And then men can develop penile, anal, and throat cancer. So that's a significant amount of different types of cancers due to one viral infection. So it's important to understand. Some symptoms and signs of this would most likely be papillomas, which we also refer to as warts. So the common thing that we think about with HPV is genital warts. But there can be other forms of warts that appear due to this virus as well. Some types of HPV will cause warts, and some will cause cancer. And if cancer is not treated, it can start showing signs. At a certain point, you can start having fatigue, weight loss, and abnormal growths within the body or on the body, outside as well. This is a very, very small list of symptomology that you'll see from cancer specifically. So this is a very small list, but just a few things I wanted to point out. So why HPV? Why did I choose focusing on this topic? I think it is a really important topic. From the research that I have done, there is a lack of overall public knowledge on HPV and its devastating effects. It's a nasty, nasty disease. And like I said, it's lifelong. You can't get rid of it. Once you have it, and that's it. It's also a very preventable disease due to its vaccination. Some of the percentages and statistics I'll provide throughout the presentation will help to solidify this claim, give that background knowledge of why vaccination is so important. But also, too, this is one of the lowest vaccination rates for adolescents in the US, which is really unfortunate because this is something that we could start early on and help prevent disease in the future if we can do so. So also, too, I really want to provide education on this topic. I think it's important. And like I said, it's encouraging in disease prevention, which is ultimately vital. I want to give a little bit of information on the HPV vaccine itself, what the name of it's called. The brand name is called Gardasil. So if you ever hear the name Gardasil, they're talking about the HPV vaccine. That is the only vaccine that can be given in the U.S. at the moment. It's referred to as a 9-valent vaccine, which means that it covers 9 different types of HPV strains. But there are over 100 types of HPV. There's a ton of them. Viruses can look like many different things to the immune system in the body. So there's over 100 different types of HPV that we know of. There are HPV types, like I said earlier, that cause genital warts, but there's also types that cause cancer. So this vaccine is given in 2 or 3 doses. From ages 11 to 14, you are given 2 doses, so 2 vaccines. You can also start this at age 9. So ages 9 and 10, you can also start this vaccine series. But the CDC recommends starting at ages 11 to 12. Ages 15 to 45, it would be a total of 3 doses. So the CDC, the Centers for Disease Control, which we all know very, very well because of all the information and guidance they've provided due to the COVID-19 pandemic that we're still dealing with, they're the ones that make recommendations for vaccine administration. So the CDC recommends Gardasil for ages 9 to 45. The recommended age to start vaccination for the first dose, like I said, is ages 11 through 12, with the second dose 6 to 12 months after. But you can start at age 9 if you desire to do so and a healthcare provider that you consult with agrees. Age 14, so at the end of age 14 would be the stopping point. So anytime after your 15th birthday and up until age 26, you can also get the HPV vaccine. You're fully eligible for it, but you need to have 3 doses instead of 2, and that is within a 6-month interval. From ages 27 to 45, because the CDC does allow the vaccine to be used up until age 45. It's not necessarily recommended by the CDC, but this is a decision between the patient and their provider. So you can still get it, but it is up to the patient and the provider, that mutual decision making. And the reason why it's not necessarily recommended is by this age, it's very likely that sexual relations has already occurred and that an individual has been exposed to HPV. So if you've already been exposed to HPV, this means the immune system has already dealt with it in a certain way. But this also reduces the effectiveness of the vaccine because viruses like to change. They like to try to evade the immune system. So ultimately, the effectiveness of the vaccine is reduced, which is not ideal. So that's why we try to get it done at an earlier age before the body can be exposed to this disease so that it can be more effective in the future when the body does actually get exposed to this. And just quickly, the HPV vaccine in terms of its benefits and drawbacks, not a lot on both sides, but I did want to talk a little bit about it just because, there's a lot of hesitancy around vaccines. Again, this presentation is not meant to say, hey, go get the HPV vaccine. This is what you need to do to be safe. That is a personal decision. But, one of the biggest tools that we have to utilize against disease is vaccination. So I do want to provide a little bit of information about both the benefits and the drawbacks. So as I'll say again and again in this presentation, which I'm hoping you're really starting to get ingrained at this point, and as I continue forward, the benefits of getting the vaccine, it's a prevention of acquiring HPV and its ultimate effects. So those genital warts I was talking about. And your genital warts are overall harmless. They're a pain. A lot of people want them removed, but they're overall harmless for the most part. They're benign little growths. The problem is cancer. That is very dangerous and deadly. That can kill you. So it is ultimately a prevention against cancer as well. And also, too, a huge benefit is just less transmission of HPV. Unfortunately, in the US and worldwide, actually, it's very hard to control diseases that are sexually transmitted because it's just something that happens and a lot of people are having sexual relations. So if we can get people vaccinated against diseases like this, they're not going to per se acquire it or necessarily transmit it to other people, and thus, HPV rate goes much higher. In terms of drawbacks, though, there's very, very few, and that's ultimately just the vaccine side effects. So the most common effect that you're going to have from a vaccine, including the HPV vaccine, is pain and swelling at the arm where they inject and stuff. So that's usually very temporary, a few days, muscle soreness and aching, nothing too significant. You can also have dizziness and fainting, headache, nausea, muscle pain. These are less common, but they do happen with vaccines. They're not ideal, but they're also temporary. But there also are very rare instances of serious allergic reaction to vaccines. These are very, very rare. And remember, when you're thinking about vaccines, you have to think about the cost versus the benefit. And the benefit of being protected by disease, is much more significant in my mind than the risk of having a severe allergic reaction. And even having a severe allergic reaction, that can be treated. It's not like you just instantly will die from something like this. And this is usually why there are vaccines and stuff that we, like COVID, for instance, where you try to make sure that somebody's okay for 10 to 15 minutes before we send them out the door. But like I said, it's a very, very rare occurrence. It's not something that should deter individuals from getting the vaccine. All right, I do want to talk about who exactly gets affected by HPV, and that is everyone. Nobody is exempt from this virus. Like I told you earlier, HPV is a widespread disease. It's the most common sexually transmitted disease in the US, so nobody is exempt from this disease. All right, ladies, you are up first. So this vaccine was originally recommended solely for girls, and it's still vitally important for the prevention of HPV in girls. So girls ages 11 to 12 is when you start that 2-dose vaccine series, like I said earlier. Most HPV infections occur within the 15 to 24-year-old population. So 74% of all HPV infections. That's pretty significant. That is 3/4, about 75%, right, of all individuals who get it are between 15 to 24%. And if you think about that, that makes sense because that's a younger age, usually more sexual relations. So you're going to have more exposure to HPV. So research shows usually that adolescents only get medical treatment when they're sick, instead of going in for annual physicals, which is recommended for everybody to go in for an annual physical once you start getting to those teenage years, especially. And this is usually where vaccine consulting would occur. So there's a lot of missed opportunities, unfortunately, for getting the vaccine. And especially because there's a reason I'll provide here shortly, because providers actually do have a big hand in it as well. So we as providers need to be recommending these vaccines at these time periods. So like I told you earlier in one of the last slides, for women, it's a prevention of cervical, vulvar, vaginal, anal, and throat cancers. That's 5 different types of cancers that this vaccine can help prevent, which is incredible. One of the biggest cancers, though, that HPV is a huge risk factor for is cervical cancer. It is something that we screen pretty frequently starting at age 21 and stuff in women to make sure that you don't have. Thankfully, it's a slow growing cancer, but HPV is the highest risk factor for it. It causes the most cases of cervical cancer. So this is why prevention of HPV is paramount to preventing a cancer like this. And something I found interesting too, ages 27 to 45 have the highest risk HPV strains. So ages 27 to 45. If you do get HPV, it's most likely the highest risk strains of it, the ones that cause cancer. Also, too, on the side there, you'll see the cervical cancer screening guidelines. I put that up there because I do think it is important to have an idea of when cervical cancer screening occurs. So it starts at age 21 for women, and from 21 to 29, every 3 years is when you get a pap smear, and so that's essentially when there is a little brush of the cervix in order to get some cells off the cervix to check for cervical abnormalities in the cells. And then at age 30 is when they'll start co-testing that for HPV. So essentially checking for early start of cervical cancer or HPV, which puts you at more risk for it. And then there's a certain point, 65 plus, where screening can stop, but it can also continue if you're a higher risk. So that just depends on, again, consultation with a provider. But yes, that is what women deal with, and we'll deal with men here next. So guys, you are not exempt. Originally, Gardasil was not recommended for boys and stuff. When I was younger, I never actually got the HPV vaccine at the 11 to 12. I think it was a couple years after that it started getting recommended for boys as well, because boys can develop similar symptoms, genital warts, as well as different types of cancer. So I never actually had the HPV vaccine when I was younger. I didn't have it until I was an adult. So I fell into the 15 to 26 years old range, and I had to get the 3 doses of the vaccine. But just similarly to girls, ages 11 to 12 is when you start the 2-dose vaccine series. Unfortunately, teen boys have a low HPV vaccination record in the U.S. And the problem with that, though, is the HPV-related cancers in men are actually increasing. So the record for vaccination is low, but HPV cancers are increasing. So if we don't increase the vaccination rate for boys and for men, then that rate is just going to keep increasing, which is not ideal. So like I said earlier, guys can obtain penile, anal, and throat cancers from HPV. And something that is very unique and very interesting in my mind, I'm hoping you think as well, and this study was done in Florida specifically, but I think it does have applications to the rest of the U.S. as well. HPV-related oropharyngeal, which is a fancy medical term for throat cancers are 6 times higher in men than they are in women. And that's significant, 6 times higher. So throat cancer is usually linked to smoking and alcohol. That's usually where we'll start seeing throat cancers, but recently doctors have seen increase in younger individuals who do not smoke or drink routinely. But why is this? It's due to HPV, because of that exposure to HPV. So something that I just wanted to point out to you is just some of the signs and symptoms you'll see associated with throat cancers. So one of the biggest symptoms that you'll see are large lymph nodes. So in your neck and just above your clavicles, in your shoulder area, you have, as well as other places like behind your ears and in front of your ears, you have a whole bunch of lymph nodes. And these lymph nodes, when you have disease, when you have cancer, they can get enlarged. They can become inflamed. They get bigger. And they can also be tender as well. So when you have these enlarged lymph nodes, it can be a sign of disease, but it can also be a sign of cancer. So with throat cancer specifically, you will likely have at least enlarged lymph nodes. But that's not necessarily the only thing you'll have, and you may not have it at all, but it's likely that you will. It's the most common thing that you'll have with throat cancer. But you also have non-healing sores in the mouth, throat pain, ear pain, swallowing pain. What we call swallowing pain is odynophagia. That's the fancy medical term for that. And then bleeding from the mouth as well. So just to give you an idea of how significant the HPV vaccine is in preventing throat cancer, it is a 90% reduction in throat cancers. Throat cancer is not a very common cancer. It only accounts, I think, for about 3%, give or take, of all cancers, and that's a rough estimate. But it's a very small amount based on the total amount of cancers that are out there that people are getting affected by. But this vaccine can prevent 90% of all throat cancers. That is really significant. So definitely something to consider and overall in getting the vaccine. All right, HPV affects all races and ethnicities, but there are differences ultimately and stuff between people and between different races and ethnicities when it comes to HPV. So I just want to be clear that in certain races and ethnicities like African Americans, Hispanics, and this, correlation is not causation. These folks are not always low-income individuals, but a lot of times, especially like in urban areas, we will see that they are low-income individuals. And this comes with a lot of disparities in healthcare, in care for these individuals, and ultimately in HPV-related cancers. And that's important to really know and to talk about. So just for instance, in Hispanic men, you're going to have higher rates of penile cancer than non-Hispanic men. Now, granted, that doesn't exempt Caucasian or African American men from having cancer. There are higher rates of both throat and anal cancers in Caucasian and African American men. So they don't get away with not having possible cancer. It's just higher in those groups as opposed to like Hispanic or other groups for those types of cancers. Now, among African American adolescents, the HPV vaccination completion rates are also associated with insurance status, with age, the specialty of the healthcare provider, and the site of the vaccination. So, if you're not insured, it's harder to get access to care, it's harder to get access to the HPV vaccine, and that can affect rates of, the HPV vaccine completion overall. As well as I find it kind of interesting, the specialty of the healthcare providers. Some that give this vaccine, that order this vaccine, are pediatricians, but some are primary care providers. Some, work in the ER, some in the hospital. It totally depends. But the specialty of the healthcare provider can also affect these rates, which is interesting. But also the site of vaccinations. There's a lot of issues with access to care, unfortunately. And the site of vaccination, if you have a clinic that provides these vaccinations, but you live nowhere near it and you have no way of getting to it, at a reasonable cost, you might not get the vaccine. And that's unfortunate. All right, and to give one more example, among Hispanic adolescents, HPV vaccination completion rates was associated with language. So there's a lot of Hispanic individuals that aren't fluent in English for whatever reason that may be. Maybe they speak solely Spanish, maybe it's another language. And that can ultimately lead to disparities in healthcare, but it can also lead to low vaccination rates. HPV not excluded within that. Something I did want to say before moving on ultimately is sensitivity has to be required for all populations based on race, ethnicities when we talk about healthcare, because there's a lot of disparities within these populations. Access to healthcare is still a major barrier for low-income individuals, as I talked about earlier, who are African American, who are Hispanic, as well as many other races and disparities. And this is not to dispel Caucasian individuals, because there are low-income Caucasian individuals, just like there are other individuals who may be African American, who may be Hispanic, as well as other groups. But specifically, there's a lot of research out there. There's a lot of information that states that low-income individuals who are African American, who are Hispanic, who fall into these different types of races, don't always have insurance coverage. They don't always have ease of access. So we just have to be sensitive to this, and there's ultimately a lot of work that we have to be done to ensure that these individuals get proper care, and specifically for this presentation, they need access to HPV prevention just like the rest of us. It's really important because we have to think of population health, making sure that everybody in the population is protected against disease. That is not just a privilege, that is certainly a right. All right, so the next group that we're going to talk about is the LGBT community. This is one that I am personally really passionate about because this population is highly stigmatized in healthcare, don't get the care that they necessarily should be, and it's frankly quite disappointing. So I definitely want to include this in my presentation to give how, members of the LGBT community are affected by HPV. This is not inclusive of all the LGBT community. I did not include transgender individuals. It would have been even longer than the information I provided. But the information that I do provide does kind of, provide some information to generally across the board for this entire community. But I just put a couple examples in here to give an idea. So for lesbian women specifically, adolescent and young adult lesbians are less likely to initiate the HPV vaccination due to assumption of female-to-female sexual relations being less risky than a female-to-male sexual relations. So just how exactly disease, is spread. There's just misinformation about that. They're not always cognizant, of that HPV can be spread even contact to contact, like I said earlier. But it also can be related to insurance, low visibility, and sexual health promotion. When we see advertising or see communications about being good about your sexual health, using condoms, all those types of things, lesbian women don't necessarily fall into that realm. They kind of get excluded, so they may not be as visible in that sexual health promotion, and thus they're not targeted, which means they may not be seen as much. All right, in terms of gay and bisexual men, there are low rates of HPV vaccination among this group as well, yet it is high risk of sexually transmitted infections, and HPV is certainly no exception to that. Anal HPV is actually twice as high in gay and bisexual men as in heterosexual men, and there's also 17 times higher rate of anal cancer. And I will say this is most likely just due to the fact that sexual relations between men is ultimately just a higher risk in terms of anal sex. But I don't want to make any assumptions and stuff too, because there are protections for gay, bisexual men as well as heterosexual men in terms of disease prevention. So, but it's just the statistics are showing that that is a much higher rate. So this is unfortunately affecting gay and bisexual men greatly, just like HIV did in the 80s. But this is not to stigmatize gay and bisexual men by any stretch of the imagination, because heterosexual men can easily obtain HPV as well as HIV and stuff if they're not careful with sexual relations. But this is what the data and the statistics are showing. So, like I said, this population very stigmatized in healthcare, and this can lead to not seeking out care ultimately because they don't trust healthcare providers. They don't trust, advice that is given to them from the government. This can seriously increase cancer risk, and this is a problem. So sensitivity in this population is absolutely required, just like it is for other populations that have that stigma in healthcare. That's something I try to make sure I do as a provider. I always want to be sensitive to these populations because they don't always get the healthcare that they deserve. Assumptions can be made due to sexual orientation or identity by healthcare providers, and this isn't always appropriate because then we can't treat appropriately at all times. And also, too, something that I'll mention here shortly as well, but healthcare provider recommendations is paramount in this group to increasing vaccination rates. I looked up some research and found that there was a much higher rate of HPV vaccination and other vaccination, actually, for that matter, if a healthcare provider recommends it to a member of the LGBT community. So that's something moving forward as a healthcare provider I will be certainly remembering when I help individuals of the LGBT community. All right, this is going to be really quick. I just wanted to go over a little bit about immunocompromised individuals as well in HPV. So what does immunocompromised mean? It essentially means the immune system is not as strong or as functional against disease. as somebody that you would see that has a fully competent immune system or can handle infection. We all get sick, right? We all have the ability to get sick, and some of us even severely sick. But most of the time, our immune system is able to fight off disease relatively well. In fact, HPV, there's a lot of times where you're exposed to it, the immune system just fights it off, and you never show any symptoms. But there are individuals out there that are immunocompromised, that immune systems aren't working up to the same par that many of us have. And these individuals are a much higher risk of infection, including HPV. And that has to be taken very seriously by healthcare providers as well as just the general public, because these individuals are much more at risk. That's why, during the COVID pandemic, what we're still dealing with, that's why a lot of individuals who are immunocompromised had to stay inside, away from other people, couldn't go do everything as much as everybody else could because their immune systems couldn't handle COVID, and it ultimately could have killed them. It was scary for a lot of people. So HPV, just like other diseases, can affect these individuals more prominently. So we just need to be aware of this and stuff. We need to be aware that there are individuals out there, and these individuals definitely, it's very highly recommended that they get vaccinated to help prevent, HPV disease and cancer as well in the future. I did want to go over why the vaccine rate is so low, just based on the research that I compiled, because I did find it interesting. It is a lower vaccination rate compared to other diseases. And, one of the big reasons that I found was parental concern is a major factor. Why does parental concern matter, right? We recommend that the vaccination is given at ages 11 and 12, and even up until age 18. The choice of healthcare is up to the parent, right? So they're deciding whether or not their child gets vaccinated. So their opinion matters and their influence matters. So parental concern is a major factor as to why HPV vaccination isn't given. There's presumption of not thinking this vaccine specifically is necessary, which I definitely think is misconstrued, unfortunately. Like I said, it's a huge prevention of cancer. But, we as healthcare providers need to be better about recommending this vaccine as well. It's definitely a two-way street. But there can't be this presumption of thinking that it's not necessary. Vaccines are created for a very necessary purpose, to make sure that we prevent disease. Also, there's concern about the effectiveness and side effects of the vaccine. There's a lot of hysteria surrounding vaccines about really negative side effects. One of the big ones was autism and stuff, which was disproved. But also just the effectiveness and stuff of the vaccine. Thankfully, this is a very, very effective vaccine, and usually the side effects are usually very minimal. But also in my research, I found concerns on what mild side effects mean. What does this exactly refer to? It's the parent's view of what mild side effects are versus what the provider thinks mild side effects are. So just that disconnect between, and that's what we as healthcare providers really need to, educate on, is what exactly those side effect means. But also parents are concerned that this is going to encourage sexual relations if they get that vaccine, since they're more protected against a sexually transmitted infection. Definitely a little silly. I mean, adolescent sexual relations just does not occur because of that. At least not in my opinion. There's no research to back that up from what I could find. So that is something that we need to dispel as well. Not getting a recommendation from a healthcare provider is a big one. That's why I bolded it there. Healthcare providers, in the research that I saw, that's one of the biggest reasons people get vaccines, especially and specifically the HPV vaccine, is that they get a recommendation from their healthcare provider. But there are also other reasons why the vaccine is not given. There's language barriers, like I spoke about, with Hispanic individuals, and that's not just Hispanic individuals solely. Many different races, many different ethnicities. Language barriers considers to be a major issue. But it also could be cultural factors associated. Cost and access to care is another big issue. And as I said earlier as well, missed opportunities. Like remember, adolescents don't go in unless they're sick usually, not necessarily going in for an annual physical. That's a missed opportunity to talk about Gardasil. It's a missed opportunity to talk about getting that vaccine. But also too, and this is wading a little bit into politics, but there's also a lack of enforcement of the vaccine. Not many states require it. In Rhode Island, where the HPV vaccine was mandatory for school entry, there's 11% predicted increase vaccine rate among boys. Unfortunately, there wasn't really a major change for girls. Not entirely sure why that was, but it did increase for the boys ultimately. So if it is, forced for something like school, or if it was, made to do or you couldn't go to work, you definitely see the vaccination rates improve. Now, granted, whether or not that's the right thing is not a discussion for this presentation, but enforcement does increase and decrease the rates. So I just wanted to provide a couple of recommendations for increasing the HPV vaccination rates. Again, since this can be a political topic as well, I'm not advocating you need to go get this vaccine. It's the right thing to do. But ultimately, as a healthcare provider, I do want to recommend vaccination because it does help prevent disease. We've seen that with our patients, and I do think it is important. So ultimately, healthcare providers, like I said, through the research that I've done, healthcare provider recommendations are paramount. That is a very big reason why people go get vaccines, so we need to do our part. There also needs to be access to trusted information to make appropriate healthcare decisions. As we saw in COVID, there was a lot of misinformation going around about it, which was and still is very unfortunate. So I think we do need access to trusted information so people can make these decisions for themselves, whether or not they want to get vaccinated for HPV. And I think that access would ultimately provide a higher rate. We also need to improve access to care for individuals. We need to increase insurance coverage so people feel like they can go get this vaccine without a huge cost burden. We can certainly improve translation services within clinics, within hospitals, or to make sure that language barriers aren't a big issue. And there's other things that we can do to increase access to care for all individuals, for all people, because we all deserve to, as I said earlier, have a prevention of disease. Also, too, we need to expand programs and new programs as well, include new programs to address the cost ultimately of vaccinations. There is actually a federal program and a state program called Vaccines for Children that provides vaccines, all the ones that are recommended by the CDC for children, including HPV, at no cost to children. This is awesome. So if you feel like you can't get access and provide, the vaccines for your children, there's programs like this that will cover it at no cost so that children can get vaccinated. All right, just in conclusion, HPV is a serious sexually transmitted infection that leads to lifelong warts and can ultimately lead to cancer. It's a very serious infection, and it affects everybody. There's nobody that is, per se, immune from HPV. It can affect everybody. So the vaccine is 2 doses. Recommended age to start is 11, 12 years old for both genders, both boys and for girls. And that second dose is 6 to 12 months after. It can complete up to age 14. If you fall into the age ranges of 15 to 26, you can still receive the vaccine, but it's going to be 3 doses. And if you fall between the ages of 27 to 45, it is not necessarily recommended and stuff by the CDC, but that is a discussion you can have with your healthcare provider. And you can still get the vaccine if you both decide that is the right thing to do for you. So this vaccine can prevent many types of cancer, as well as a unique one, throat cancer. I thought that was a very specific one. Even though it's not a big cancer that happens, it can still prevent it, which is important. All right, let's see what knowledge you've acquired from this presentation. Please click on this link and go fill out the questions. And I want to see if you were able to learn a bit. Thank you so much for paying attention to this presentation. I hope that you learned as much as you could about HPV and its vaccine. Thank you very much.